don't feel comfortable with leaving your camera on, that's absolutely fine as well. Fully understand that. Just to ask if you can keep your microphone on mute unless you're speaking. If you do want to contribute, please do raise your hand. Now, when I'm screen sharing, as I'm learning over the last 12 months, it's not possible for me sometimes to see the raised hand function. So we have Freya here from the Health and Social Care Partnership, who's going to be able to support with that if things do come up. Please do use the chat function to share your thoughts and your feedback, and just to say, you know, if the doorbell rings or you need to go and grab a drink, you know, please do. That's absolutely fine. I've made sure that my very ferocious Jack Russell is currently in another room with the door shut, so hopefully he won't disturb us. But if I do have to go on mute, if somebody posts anything or knocks on the front door, then I will do, just for a few seconds. Another thing to say as well is that this session is being recorded, so just to make you aware of that, and that, Freya, are these sessions shared as well?
Yeah, sorry about that, I was on mute. Yeah, we're going to record them, do a bit of editing with them, and if everyone's okay with that, I'll upload them onto the Workforce Future Centre site. Again, if anyone's got any issues, please do contact us. But yeah, for that we will upload it. Brilliant.
Now there's 15 of us in the room. I just wondered if people would be happy just to put in the chat box where it is that they're based, and you know, what's inspired them to join this session today. So I'll just give everybody a minute just to jot something down in the chat box. Hi Leslie, you've got your hand up.
Sorry, I can't access the chat, just to let you know. So
No
I'm not
worries.
rude.
No, it's fine. Leslie, where are you based?
I'm from Brightington, Wigan and Lee.
So you're in the Acute Trust, and what do you do there?
I'm the Chief AHP. We're a combined trust, actually. It's acute and community.
Ah, brilliant. Okay, thanks so much for joining. It's nice to meet you. Just have a read of where everyone's from. So whilst everyone's introducing themselves to each other in the chat box, I'll introduce myself. So my name's Karen Heggs, and in part of my working life, I'm a senior lecturer in adult nursing at the University of Manchester, and the academic lead for practice development there. But in my other half of my working life, and why I'm here today, is because I'm the project lead for Greater Manchester Enabling Effective Learning Environment, which is a HEE funded project. And the major output of that project over the last 12 months is this, which is why we're here today, which is the Greater Manchester Health and Care Learning Environment Strategy. So I'm just having a quick look at the chat box. So we've got people here from not working in the NHS but wanting to update themselves. Hiya Karen. Julie, who's a podiatrist in WWL. I've got colleagues here from Tameside. Gosh, there's a real mix of people here in the room. It's great. Physio working in West Lancashire. Workforce Programme Manager for Salford CCG. Hi Sati. Anne Stokes is here from L&D, Making Space in Health and Social Care Charity. Katie Merrick, working on food systems for the partnership. The People Development Leader at Bolton FT. We've got people from, we've got Jackie here, who's from Tameside Hospital, and we've got Gina, who's a Health and Innovation working in HR and OD as a manager there, and the operational lead from Flyde Coast. So we've got people from not just from Greater Manchester but from the Northwest. I'm going to screen share, and what I'm going to do, if it's okay with everyone, is I've got a presentation to provide to you about the strategy, just to give you some context and so you can see where things are up to. And then once I've done that, I want us to have some discussion as a group and share thoughts and ideas. Now we can do that using Padlet, but we can also have discussion in the room, and if just because I'm just conscious if people aren't able to access the technology. So we'll see how things go as we're moving along. So I'm going to screen share. If if I can find it. No.
Yeah, that seems to be up, Karen. It's on the housekeeping site though.
Ah, right, okay,
Yeah.
let me just double check.
Sometimes on the preview it doesn't, sometimes not everything you want to be there. It's a bit of a hit and miss.
Sorry, everybody.
It's all right.
I'm trying to find the right presentation. Ah, here we go. I've got too many presentations open. The joys of being a lecturer, eh? Okay. So thank you first of all to Workforce Collaborative for allowing me to present to you today. I presented at the last Workforce Summit and some of you may have been at that session. And at that point in time, we had done a lot of consultation and work with colleagues across the Greater Manchester Health and Care and Higher Education system. And we were at the point of consultation. So the strategy itself was very much in its development phase. And since then, there's been a flurry of activity and we have been able to successfully launch our strategy actually within the time limit that was set to us by Health Education England. I just want to provide sort of an overview to you first of all about why Health Education England have provided the funding to develop the strategy, then go through how the strategy was developed and some of the drivers for that. How some reflection over the last year, and then provide some more detailed discussion through the strategy. But key to this as well in this presentation, I really want to demonstrate how the strategy links with other pieces of work that are going on, particularly with regards to workforce development, including our people plan for Greater Manchester, and also the output of the repair report that was published in 2018. So just to sort of pull all those threads together really. If, like I said before, if you do have any comments, please do pop them in the chat box, and there'll be opportunity for discussion as well at the end of the presentation. Is that all right with everybody?
Yeah, that's great, Karen. Thank you.
Fab, thank you. So, Health Education England provided funding across the north of the country to look at how we enable high quality learning environments so we can ensure sufficient capacity within the health and care settings across our ICS, across our system, to ensure that we have a sustainable future workforce supply, because obviously in order to sustain the future workforce supply, we need to offer those health and care learners the opportunity to have exposure to practice. Now, that has been increasingly recognised as a strategic priority, and as in other systems, in Greater Manchester, it really is a key strategic priority. So within each system, HEE provided investment to look at how we work together as a system to manage, we refer to them initially as clinical placements, across a range of different settings, how we manage that, how we work together as a system to be flexible, to maximise how education is provided to healthcare learners across a range of settings, and how learners are supervised in the context of those settings. So in 2019, in the quality strategy, Health Education England also outlined that there really is a need to improve the education system within the context of health education in clinical settings, and that needs to be well led, effectively managed, and that there is a breadth of learning experience for our health and care learners. Now, I'm conscious we've got a range of colleagues from different settings and different sort of professional backgrounds here in the room. But to say that this strategy is aimed at pre-registration non-medical healthcare learners. So we're looking at our nursing associate learners, AHP and midwifery learners, but acknowledging that obviously, when we're thinking about the context of health and care, that, you know, the outputs of this strategy will have a positive impact across the whole health and care delivery system. So what they wanted to do was look at how we enabled quality learning environments to make sure we've got enough capacity for our future workforce, and also that those experiences will allow the knowledge, skills, values and behaviours in order to deliver the absolute best quality of person-centred care across our system. And the funding awarded would lead to the development of a clinical placement strategy, which is what we've got here today, an educator faculty development that was incorporated as part of the Year 1 Enabling Effective Learning Environments funding and is fed into the strategy, and then innovation in supervision. And it says here around preparing for future nurse and standards for supervision and assessment, but that's since been adapted to be a much more multi-professional approach. And supervision and assessment is now being managed across the North West using the Enabling Effective Learning Environments funding from each of the ICS across the North West, so Lancashire, South Cumbria, Cheshire, Merseyside and Greater Manchester. And the other thing to say is that for colleagues not from Greater Manchester, so colleagues from Cheshire, Merseyside and Lancashire, South Cumbria, in your ICS, there is an Enabling Effective Learning Environments project and a strategy for your ICS as well. As EAL, as we will refer to it moving forward, as leads, we link really closely together. And that overall piece of work is being managed by Hannah Evans, who is the lead for this piece of work at Health Education England in the North West. So at the start of the project, which was back in February in 2020, when we didn't quite know, when we weren't expecting what was going to happen over the next 14 months, we developed an initial piece of work and employed a communications consultant to begin to develop some workshops to try and identify what it is that we need to do in order to move forward. And one of the key outputs of that was a real feeling that there needs to be a culture shift in Greater Manchester when we're thinking about practice education, and that we need to do that in order for us to enable effective learning environments, and that needed to be a key driver for the strategy. One of the first things that we identified that we need to do is change the way that we talk about placements. Now, I, in my role as a practice development lead, use the term placement a lot. What I was able to do through extensive scoping was actually identify that we use the term placement to mean about 8 different things. So the word placement is used interchangeably across the system by lots of different key stakeholders in lots of different contexts. And actually we need clarity about what we mean in order to enable effective learning environments in the language that we use. So when we're talking about placement, placement is actually the act of allocating a learner to an identified learning environment. So identifying their learning needs and then placing them in the most appropriate learning environment to support their practice education development. A learning environment is a space for learners where they can develop those knowledge, skills and values that we need them to develop, and also that they can be supported to achieve their educational outcomes. So what they need to achieve in order to complete their programme of study. And if we get placement and the learning environment right, then and they are welcomed into the team, then the learning experience is very much enhanced and delivered, moving forward. So what we've started to do across Greater Manchester is change the language that we're using, and we're seeing this across communications to learners, we're seeing this across communications in meetings. The language that we're using is very much changing. And you'll also notice as well that I'm not using the term students, I'm actually using the term learners, and we're seeing this happening more and more in communications to our learners, in the way that we discuss learner requirements and needs in our learning environments. And I know it sounds simple and straightforward, and some people may disagree, but we're really starting already to see a positive culture shift in the way that we are approaching the value of the learner and the learning environments. Now, what I would like to say is this strategy has not just been written by me. It's been developed in really close collaboration. So we have our 10 provider organisations across Greater Manchester, including the North West Ambulance Service, who utilise Greater Manchester for some of their learning experiences, with Edge Hill University having a hub here in the Manchester City Centre. The 4 Greater Manchester universities, so University of Manchester, Bolton, Manchester Metropolitan and the University of Salford. The student quality ambassadors have been absolutely pivotal this, so the voice of our learners have been absolutely central to the development of the strategy, and they've had a key input and have steer and will continue to have steer in how the strategy is developed and delivered. And we've also had input from colleagues working within the Greater Manchester Health and Social Care Partnership, particularly in relation to social care and care home provision, the care home sector. All of these organisations have been involved in some way or another in the development and consultation. The consultation itself of the document had over 200, it was almost 250 people engaged in that consultation at a time as the second wave of COVID was just hitting, really. So to get that engagement at that time was fantastic. And those consultations took place both through online meetings and through the use of online forms as well. So just to make you aware that there has been real involvement across the system. The other thing to say is that the steer for the project has been really effectively managed through the use of a key contact for each organisation. So we have an organisational lead contact who is on the steering group for the whole piece of work and the project, and they will continue in their role in the second year, and their key contact into their own organisation and also in coming back to me from their organisation, and that is representative of all of the 3 professional groups, so AHP, midwifery and nursing. We've also had the opportunity for a voice at key professional body and professional group meetings within Greater Manchester, so the midwifery education group, the AHP faculty and the community of practice group for nursing, and I report up to the workforce collaborative, up to the workforce oversight committee. So and this piece of work is overseen by the Programme Management Office, which is central to the strategic management of practice education and delivery across Greater Manchester. But the last year has been challenging, and I suppose the one thing to say is that it would have been quite easy actually in March, April of last year, just to say, well, you know what, there's a lot going on. Everybody involved was involved in the delivery of practice education at a really difficult time as services were impacted, as we were all pulled into the management of deployment of our AHP, midwifery and nursing learners. And we asked for an extension in the period of time to be able to do this, so moving from October through to March. And when I went to the steering group, the voice of the steering group was very much, actually, no, Karen, what we need to do is we need to embrace the facilitators that COVID-19 offers. And if there was ever an opportunity to embrace and move forward with change, this is it. Because we've identified new ways of working, and let's just do it. So we did. So from sort of March for 6 months through to sort of June time, July time, I led very much on scoping. So wanted to find out and get down to the grassroots of the challenges and the facilitators in the enablement of effective learning environments. But as I've said, there was impact on the delivery of education in practice and education in the universities. So from a university point of view, we had to move to online learning very quickly. And there was a lot of movement in service delivery out there, as you're all aware, in this room. But we had fantastic engagement across the system, and the steering group, which is a 45-minute meeting at 8:30 once a month on a Wednesday morning, we had pretty much every organisation represented at every meeting. And we really developed a community of practice. We worked really effectively as a system to get to the point that we're at now, to be able to launch our strategy on the 26th of March. And it really allowed us to maximise the fantastic partnership working that we have here across Greater Manchester and look at a really solution-focused approach to how we address the challenges that we face on a day-to-day basis when it comes to practice education and enabling effective learning environments. And I suppose the one thing to say on reflection is that actually this addressing the strategy at a time of COVID and developing strategy at a time of COVID actually really allowed us to open up the difficult box and give us permission to step back from day-to-day practice and think about how we do things in a different way and think about how we look to the future and sustainability in the challenges of learning environment capacity, how we access a range of different learning environments, and ultimately how we drive forward that culture shift. And already we've seen that happening in engagement and in the delivery of the strategy so far. Despite all the challenges last year, we had multiple work streams that were ongoing. We had individual projects that were funded using the Enabling Effective Learning Environments project funding for year one, including the development of a framework to support personalised care and social prescribing, how we look at different ways of working, the development of a piece of work around educating the educators, so the development of a career framework for Greater Manchester practice educators, moving forward to the development of a centre of excellence for practice education, which will be embedded over this year, and a profile and a self-assessment tool for pre-registration education, and what to support our educators to develop and grow. We've looked at the hub and spoke model that's utilised across a range of different programmes here in Greater Manchester, how we prepare our learners for practice and how we welcome them. And all of this work is fed into the strategy and will be embedded in its implementation moving forward. Around that, we've had a robust communications plan. And also around that, we've got the Northwest work around education and assessment and supervision. So what is our vision? What's the vision of the strategy? Well, it's about innovation and integration for pre-registration healthcare programmes in Greater Manchester. The strategy is here to maximise the partnership working that we already have and look at how we can work together as a system to develop a solution-focused approach, and also how we think about learning environments. And originally the strategy should have been a clinical placement strategy, but we've pushed back against that and said, actually, by just limiting it to clinical and the term placement, we're actually limiting the art of the possible. So why can't we call it a health and care learning environment strategy that will allow us to maximise the range of different learning environments that future health and care workforce can experience across the range of their programme. But key to this is encouraging responsibility for practice education, it being within a culture shift that it's everybody's responsibility, and that we do that through empowerment and collaboration across the system. But I want to demonstrate to you here as well how this links to Repair. So Repair is a piece of work that was led by Health Education England, including Professor Mary Lovegrove back in 2015, and they did a study looking at the reasons for attrition from health and care programmes, which has significant cost to us as a society, but also a huge impact for on the health and well-being of those learners. And what they identified within this really important study when it was published in 2018 is that there are 4 stages to attrition. That can be before the learner even enrolls on the programme and their experience at the point of enrolment, their experience throughout the course, so how they're made to feel, their sense of value and belonging, particularly during years 1 and 2. And then what they identified as the flaky bridge, which is 3rd year through to transition into the workforce, where there is a significant risk of attrition. And then also thinking about that early career support and preceptorship. Now, Repair itself identified 15 recommendations, and apologies if you can't see this slide very clearly, the wording's a little bit blurred. But the output of Repair, as with our strategy, is it's around a culture shift to involving collaboration between learners, universities and providers. And the strategy itself has looked to the output of repair and ensured that the key messages from that are embedded within the strategy and the work that we do moving forward. And it links to 3 recommendations, that being the model of supervision in practice, clarity of the student's role in practice, and fostering a culture of change. And we need to address these factors if we want to both recruit and retain our health and care learners, but also in ensuring that we don't lose our health and care learners early on in their career, wherever that may be. And central to that is ensuring that the experience that they have in practice is of the best quality in order to enable effective learning in those learning environments and to ensure that the learners we have the experience that they need so that they can feel welcomed and belong, and that they feel moving forward that they're adding value to and feel a valuable member of the team whilst they're there. So the strategy itself is built on 3 very simple pillars. And the pillars were developed through key stakeholder consultation. And the 3 pillars are get prepared, embrace the experience and model the future. And what I would say is, although it does appear that they come in chronological order, there is some crossover between timings of when these pillars are effective. But as you can see, there are sort of key messages and drivers in each of these 3 pillars. And as I said, the themes that were identified were following an extensive period of scoping and following extensive consultation, and have been somewhat condensed. But I think the number of themes is reflected of the complexity and the challenges of educating our health and care learners, and something that we need to address. And what we've identified is that we need to address all of these themes. Some of them link, some of them not so much linking, but we need to address all of these in order that we can enable effective learning environments to ensure our future health and care workforce, and ultimately address the challenge of learning environment capacity moving forward. What I'll do now is I will talk through each of the different themes within the pillars, just to provide some oversight to you about what each of the different themes means, if that's okay with everybody. Can I ask, has anybody got any questions so far? I feel like I'm ploughing through this a little bit. I'm so used to presenting it now. Is there anything in the chat box at all?
I've got a question, Karen, if that's okay. It's
absolutely. Matt. Hi, Matt.
You mentioned that the 3 pillars were prepared after input from stakeholders. Who were the stakeholders on this? So
the stakeholders were representation from the Voice of the Health and Social Care Partnership, the 4 universities, the 10 NHS provider organisations, and learners who from AHP, midwifery and nursing.
Did we ask any of the people who had dropped out, the sort of lost learners, let's say?
No, we weren't able to capture their voice, but their voice is captured in the output of the repair report. So making sure that is embedded absolutely in the work that we're doing.
Awesome, thank you.
Thank you, thanks so much. So what I'll do now is unless there's any other questions, I'll go through each of the pillars individually. Is that okay with everybody?
Karen, sorry, could I ask a question?
Of course you can, yeah. Hi, Karen.
So you said this is specifically for GM, and you were saying that Cheshire and Mersey and Cumbria Lancs have their own strategies.
Yeah.
Because I can the elements of what is in the GM strategy appear to me that they would relate also actually nationally, not just in GM. Maybe the implementation may, and the priorities in each region might change.
Yeah.
But why do you think it's necessary for each of the even Northwest ICSs to have a different strategy?
So it's an interesting question, Karen. So I think the thinking behind that is that the geography and the socioeconomic needs of each and health needs of each of the different ICSs does vary. The way the numbers of universities, the number of providers and different care providers within would need to be taken into consideration. But I do take your point, Karen, that actually a lot of the stuff that's identified here would be relevant across each of the ICS. And I suppose the other thing to say is that each of the ICS at a very different point in developing their strategy. So Cheshire and Merseyside are at the point of going to consultation for their work, and Lancashire and South Cumbria, they've recently advertised the post to lead on that piece of work. So there are different priorities in each of the different ICS. But yeah, you're absolutely right. I think themes from this are relevant across the board.
Okay, thank you.
That's all right, no problem. Are there any other questions at all? Okay, so the first pillar is get prepared, and here we say that it's vital that learners, learning environments, care provider organisations and universities are prepared so that practice education can be effectively supported. And this pillar, we identify themes that focus on the need to continue to build on partnership working and collaboration to enable effective learning environments. And it's about how we look at funding that comes into the system to facilitate learning environment capacity, how learners are prepared and welcomed into those learning environments, and how we raise the importance of the role of the learner across the Greater Manchester health and care system. So what we want to do is look at the impact of investment. So making sure that any investment that does come into the system in order to facilitate practice education is absolutely maximised for the benefit of the whole system, and that we continue to develop and further enhance processes to share best practice and learning from each other. Because what we've identified, particularly across each professional group, is there's areas, fantastic work that's going on, but that then needs to be shared across each of those professional groups. So we're taking a much greater multi-professional approach to how we're thinking about practice education moving forward and learning from each other so much. Looking at developing a process, told you my dog's barking now. So we're developing a process to how we identify and manage new learning environments across the system and the complexities of that, and how we look to support the increase in numbers, to develop new learning environments across the system. Also building on the work from the last 12 months and looking at how we prepare learners by the universities to come out into practice across each of those programmes, and that work is done and developed in partnership with provider organisations as well, and making sure that the learner is prepared from the very start of their learning journey, and that this evolves as programmes develop. And then once we've prepared the learners, when they come into the organisations and into those learning environments, that they're welcomed and prepared, and that the information they get is consistent across the board, and that they get key information in each organisation and each learning environment, so that they're welcomed into the organisation and that they feel a valued member of the team from the moment that they arrive. And I'm really sure that we know that this is already happening across the system, but it's just thinking about how we can standardise that and make sure that we have almost like a gold standard for how that is managed across the system. But importantly, particularly for this presentation, is valuing learners and thinking about the output of repair, but thinking as well about how they are the future of our health and care workforce. So even the language that we're using, so rather than taking a student, we're welcoming a learner to the team. We're looking at all learning environments across Greater Manchester to support the development of the future workforce, and that we understand the challenges of future workforce requirements and thinking about, what's coming into the system in order we can facilitate what's coming out into the wider system. And also developing an approach where learners are seen as colleagues and our future workforce, and that whilst they're in that learning environment, they contribute positively to the delivery of person-centred care. Through Embrace the Experience, what we want to do is support the facilitation of learning and education in practice, and that ensure that all those involved in embracing the experience of learning and educating, that we must ensure that that is valued and clearly identified and embedded across Greater Manchester. So maximising the value of practice education across Greater Manchester and making sure that practice education is central to curriculum development across all health and care programmes. But key to this is also embracing the value of the role of the educator. So promoting a culture of acceptance of supporting education in practice as part of our day-to-day practice, and not the role of one or two people, but actually the role of the team, so that the learners are valued and that they have a positive experience. But we also want to cultivate clarity and consistency in the roles of educators, and we want to reward educators for the important role that they play in developing our future workforce. We want to look at the development of roles in the universities, because there's a range of different roles in universities that support and facilitate practice education. And we also want to make sure that we continue to assure the quality of practice education and engage with all of the developments that are happening across the North West in making sure that that is absolutely streamlined and in line with the quality assurance framework from Health Education England. And in modelling the future, we want to look at how we can be innovative and forward thinking, and COVID has really driven forward some fantastic developments, and things that we have always sort of been in the, difficult to do box have actually been brought to the front, and there's been some great innovation and developments, supporting learners using online platforms such as Teams, where learners have been welcomed into leadership teams and engaged in projects, for example, the use of simulation. But there's lots of challenges that we need to overcome in order that we can do this. So we need to understand and overcome identified barriers and extend our approach in what we perceive to be an effective learning environment. And it's not just a clinical focus. So we want to drive innovation in models to support practice education and practice learning in Greater Manchester, and move beyond, in inverted commas, traditional models of practice learning, and think about different models to facilitate practice education out there. We want to really overcome barriers to integrate social care into healthcare programmes, and look at exploring practice learning opportunities and identifying what the barriers are to accessing those different learning environments, and also ensure that we explore, scope and develop the profile and value of social care learning opportunities, and that we ensure learners have an understanding of cross-sector care to promote the health of the Greater Manchester population. We want to do the same for primary care as well, and there's some fantastic developments across Greater Manchester in the development of primary care networks as learning environments, and we want to make sure again that the links around cross-sector care, but ensuring that we consider the insight into the concept of neighbourhood and place, and have a greater understanding of that when we're thinking about learning environments for our health and care learners, and also maximising opportunities for simulation and virtual learning. We want to meet the challenge of learning environment capacity head on. It's an ongoing challenge for us all. Nationally, this is a challenge, but make sure that we're not just focusing on capacity in terms of numbers, but actually addressing the real challenges that support capacity development. And I really do believe that if we can get prepared and embrace the experience, we can model the future in terms of meeting capacity challenges head on. And also by looking at how we utilise capacity across Greater Manchester. There's some fantastic work that's already underway across different professional groups, both in Greater Manchester and the North West, but developing a methodology for fair share allocation, thinking about how we engage educators and in the development of learning environments, and clear processes for the management of that. In summary as well here, we want to address the challenge of private and independent voluntary organisations and ensure in how we are able to develop those as learning environments. But then once that's happened, ensure sustainability and be very creative in how we facilitate those range of learning environments across a range of care sectors. And there's been some fantastic work already happening, particularly around third sector engagement, and also with care home engagement as well, and really excited about that moving forward over the next year. Before we go on to some sort of group discussion as well, I would just want to link here as well, so the strategy to the people plan for Greater Manchester. So I hope you can see through some of the discussion that I've presented to you so far, that by embracing experiences, by preparing our learners, welcoming our learners, valuing the role of the educator, seeing the learner as a valuable member of our health and care team in the delivery of person-centred care, different ways of approaching learning environments, a breadth of learning experience across our health and care system in Greater Manchester. Some of the key pillars linking to the people plan for Greater Manchester and that workforce strategy, and looking after our people, that sense of belonging to the health and care system, and new ways of working and delivering care, also applies to how we prepare our learners and our future healthcare workforce by the experiences that they have and the quality of the experience they have through their health and care programme, whatever that may be. And that making sure that the strategy that I'm presenting to you today links very clearly with the outputs of repair, but also links very clearly with our people plan for Greater Manchester, because it can't be out of alignment with those incredibly valuable pieces of work, and can't be seen in isolation. So that's all I wanted to say about the strategy, and I wanted to come to you now. I'm just going to stop screen sharing just for a minute so I can see everybody. I'm sorry about the dog. I knew that would happen. It normally happens when I'm in the middle of a lecture as well. Just looking at how many people we have on the call. So there's 16 of us on the call. So rather than using a Padlet, if it's okay, because there's a small group of us here, whether people feel comfortable to share discussion verbally, or by including discussion in the chat box if you're able to access that function. So what I want to ask you first is this question. So if I can find my presentation again. Can everybody see? So yeah. I want to ask you, as a group of people here, thinking about workforce development for the future, what impact do you feel the strategy will have for the health and care workforce for Greater Manchester? So I'll just give you a minute just to think about that question, and then if you either want to pop something in the chat box or raise your hand, just to sort of facilitate some discussion around this question. So what impact do you feel the strategy I've presented to you today will have for the health and care workforce in Greater Manchester? So I'll stop screen sharing. Okay, so there's some hands up here. So hi, Karen. You're on mute, sorry.
On mute, sorry. Well, for me, what is really good to see, so I'm someone that worked in the NHS for a long time in workforce and education roles, and in the last 3 years I've worked in the care sector and the charity sector. And over the past year, as we've all seen, just how much the NHS needs social care and the charity sector, and vice versa, how important it is that they all work together. So I think one of the really, really great things in that strategy that I've seen is this gives the opportunity to help our future workforce and our learners to understand the system by the learning environments and the exposure that they have to the wider system.
Yeah.
And that how all of those systems need to work together really, really well. So I think that's the key thing that for me stood out, that is different to what you know, you've heard before. So yes, of course, it's about valuing our learners, valuing our educators, but it's making sure that we have people in all of those different learning environments across the system, and not just in the NHS, that are also empowered to be able to input into the future workforce.
Yeah.
So there needs to be almost investment in not just NHS learning environment settings. That would be my real wish.
No, that's such a valuable point. And, you know, to echo that really, when we did consultation events with our learners, what they said was that a lot of them didn't actually know different organisations existed or different systems existed outside of the NHS. And actually, if they have exposure to that, they may think about that as a potential future career option.
Yeah.
But if they don't see that as a career option because they don't have exposure to it, then that won't cross their mind. And I absolutely agree. It's
they want to work in the NHS. It's so important that the people working in the NHS understand the wider system.
Yeah.
And we can be working against each other in that, you know, if we can't get people out of hospital and keep people out of hospital, the hospitals can't cope. Or the community services, you need those wider social, all the, you know, voluntary independent charities, the amount of things that are being done in those spheres to keep people well, living well, early detection and prevention.
Absolutely.
Is so important.
Yeah, absolutely, Karen. And I think one of the things they identified through scoping is actually there's lots of barriers to accessing that range of learning environments. So as a system, we need to come up with these solutions, and we've started to develop those solutions, but that's going to be a key part of the implementation plan. So to reassure everyone, this document isn't just being written and published and that's it. We have a really robust, measurable implementation plan for the next 12 months. And I have a team of people working with me who are going to be able to take this forward, which I'm really excited about. I want to keep the strategy alive. I don't want it to just be something that sits on someone's desktop or is printed off and stuck on a shelf. It has to be sustainable. So thank you for that, Karen. Leslie, you've got your hand up as well.
Yeah, sorry, it's only because I can't use the chat box. It was just to say that I think for me, my first reaction was I was going to say something around standardisation, and I don't think that is the right term. I think it sets the expectations, and I think it's the expectations of everyone concerned, and the fact that, you know, having a learner with you is a really positive experience, but we expect people to do that. It's not around you choose to do it or it's an add-on. It's an expectation of the role. And then I think it also gives the learners the what to expect when they go on placement. So I think it sets the expectations for everyone that's involved in that learning experience.
Yeah, absolutely. I would completely agree with you there, Leslie. And I think it is managing those expectations. It's so important because, you know, mismanaged expectations can lead to a poor experience for everybody involved, can't it? And sometimes a negative experience that then can have a knock-on effect. So thank you for that. Just looking in the chat box, Jennifer said, sorry, I'm just going to scroll down here, that Sati said that hope it will lead to improved consistency and quality across a broader range of learning environments. Absolutely, that's really what we need to be looking to. Completely agree. And Jennifer said that I feel it will level the playing field about the difference in learning environments within different trusts. The change in language will also help. I'm glad that you feel that. And as Karen's highlighted about bridging gaps between NHS and non-NHS. So you said there was a physiologist as a national shortage since the degree became part-time. There's staff in and out of the NHS that have transferable skills. Yeah, absolutely. Right, okay, thanks so much for that, Jenny. So this is really positive to hear, and I'm glad that you feel that those things have come through in the strategy, because like you said, Karen, it's maybe things that some of the things that that are in the strategy, things you would hope would be a part of, you know, our day-to-day understanding. But I think it's important that they're there for people to see. but acknowledging the need to think outside of the box. And I think that's the decision why we said we don't want to call it a clinical placement strategy, because by calling it that, we're already putting blockers up. And HE were absolutely fine with that. So I'm just really conscious of time. I just want to ask this next question. I'm going to ask you this one. So I want to ask, what themes in the strategy have resonated with you the most? So from some of the things that we talked about, and what I'll do is I'll re-show the 3 pillars so you can see that. So were there any themes, in addition to the themes that we've already discussed here, that really resonated with you, or maybe where you feel there could be challenges or areas for development and improvement? Sorry, I can't see if anybody's got the hand up either at the moment. Is anyone?
It's me again. Sorry, Karen.
It's all right. No, it's absolutely fine.
I think, you know, we talk a lot about leadership and, you know, a leader's born or made, and it's the same with educators, I think. I think there isn't as much value placed on the importance of that role, but also, yes, people may have a natural propensity, but it is understanding that, you know, we need to support, develop those educators to help them think outside the box in light of the rest of the role that they have. Like, it's part and parcel of their everyday role. You know, every interaction, every conversation, they're role modelling, learning for learners, aren't they?
Absolutely.
We're all learners, we're all learning all of the time.
Completely.
But I think there's still a perception that people think education is something separate. It's in part of a way of being, as part of a role of a professional healthcare professional. And it's maybe involving, you know, the new roles, the nursing associates, the roles that aren't maybe in a traditional placement. So people that work in corporate services, the amount of nurses that would work in a corporate central role, and what role are they playing in having learners as well. It's thinking much wider around what we mean by an educator. Yeah,
absolutely. No, I completely agree. And I think maybe for those sorts of roles, or, you know, non-NHS settings, it's almost you know, I think there's a historic degree to how that's managed. So, you know, the way that healthcare programmes are delivered now, and the content of the healthcare programmes has very much evolved and changed. And I think we need to make sure that the learning environments are reflective to facilitate the learning that's required. So absolutely. So those leadership experiences are pivotal, aren't they? And you know, the breadth of that, and already I think during the last sort of few months particularly, we're seeing leadership opportunities. Colleagues at Health Education England are facilitating learning environments. So learners are spending time with senior colleagues in Health Education England and getting incredibly valuable insight into how their role works. And, you know, from a leadership perspective, that, you know, it's phenomenal. And a lot of that's been facilitated using this platform, but the learners still feel a part of the team and feel incredibly valued, even though they're not necessarily geographically in the same location. So I think, you know, the use of online platforms and forums really just support with that. Matt, you've said about the focus on the experience and our role in designing it and the involvement of stakeholders. Yeah, absolutely. So do you want to add to that, Matt? You mentioned about assuming challenges and just guessing what the solutions are.
Yeah, I mean, that it's great being solution focused, but if we don't understand what it is we're trying to fix or make better, then we can spend an awful lot of time and resource, which I think we're all guilty of sometimes, creating a lovely program that actually is never used or facilitated because it doesn't actually fix the real problems. So by making sure you've got the relevant people on board from the start and listening to them, then you're more likely to fix what actually needs fixing rather than what you assume needs fixing. Yeah,
completely agree. And I think, you know, what we need to make sure and ensure moving forward that, you know, we keep listening to that stakeholder voice, and you know, that we're not you know, we don't ignore it because it's so powerful. You know, the input of learners to this piece of work has just been phenomenal. Their input into their experience, their, you know, what's important to them, and their passion and engagement in taking this forward is really powerful. So completely agree. And
I mean, it's any project work really. It doesn't have to be learning environments. It's anything.
No, absolutely. Thanks, Matt. Sati, you've got your hand up.
Yeah, I just wanted to raise 2 points. Apologies, I'm the one with the building work. There's always one, isn't there? You've got the dog.
All right. I've got the dog.
Cats. So the 2 points I wanted to make were the kind of quandary about primary care. So we're focusing on the additional roles reimbursement scheme and getting more of the MDT out into primary care, but that's got its challenges. So I just think we can't underestimate the importance of seeing if we can get some of our learners pre-qualification out into primary care, so that we can start to feed that in and have people that are graduating and coming out who have got an appreciation of primary care. I have to say, I worked many years as an AHP before I went into this role, and my role is primary care workforce, and I can hand on heart say I didn't understand primary care, and I'd been working as an AHP for many years. So there's a huge rift there that we need to somehow crack by working across the system. And the second thing is, absolutely, just as we've all learned from new ways of working and doing things in our day jobs, we really need to harness the learning from delivering learning, and I don't mean placements, I mean learning in different shapes and forms, and not lose that and go back to those traditional X goes out on placement to Y. So many different ways of learning. We just need to be really mindful we don't lose any of the gains that we've made.
Completely agree, and I think I suppose to some extent I'm fearful of that it'd be quite easy for us to slip back to how things were pre-COVID. Can we say that? But actually, you know, I think my hope is that having this document, having this as a key strategic agenda will really help to prevent that from happening and try and maintain that on, you know, that forward facing direction, Sati. And I'm really glad that you've acknowledged there as well the importance of primary care, you know, from learners being in primary care, and, you know, the importance, regardless of their professional background, that we need to get them out there. Again, you know, going back to what Karen said earlier around, you know, that cross-sector care and understanding the breadth of how care is delivered. So there's a project. I'm sorry, I'm really conscious of time, everybody. I'm just going to go slightly over by a minute or two. Is that okay, everybody? There was a project funded by Year One, EEL funding, around called the Place-Based Pilot, based over in Tameside and Glossop, that was led by Dr. Ali Lee. So Ali's been very heavily involved in quite a lot of the development of the strategy. So we're going to take the outputs of that and look at how we can drive that forward. But there'll be a piece of work, Sati, looking at, you know, how we overcome barriers to accessing primary care.
Like you say, it's that wider system experience, you know, getting away from people just going to a secondary care setting. There's so much to learn from VCS and other types of placements, public health. There's much more that we can be doing for our learners to bring them out as richer, more kind of rounded professionals.
Completely agree. I'm really sorry, I've gone ever so slightly over. I'm just going to finish by saying a couple of things to you. I'm just going to flick through this. Okay, so just to say that the strategy is is going to be delivered really clearly. There is a website, and I'll post the website in the chat shortly. If you haven't had the opportunity to visit the website, please do. We've got a really useful video and resource on there that you can access. There's communications materials. If you do want to contact me about the strategy, I'll put my email in the chat box as well. You know, if you are keen to be involved in any of the work streams, please do let me know. And this is a call to action to everybody across Greater Manchester who is involved with the development of our future health and care workforce to visit the strategy website, to link within your organisation around the strategy. It was sent and communicated to heads of nursing, chief midwives, chief AHPs and HRDs as well, by Professor Cheryl Lenny. So they've all had access to this document, and there are plans within each organisation to be able to take this forward. Thank you so much for joining the session today. It's been lovely to meet you all, and I really value and appreciate your input. The summary and the evaluation has been popped in the chat box there. I'll post my email address here, so you have that. If you've got any questions, please do get in touch, and take care and look after yourselves. It's great to meet you all. Thank you.
Thank you, Karen. For those of you that are still here, I really appreciate if you would just fill out the Menti link that I've just sent everyone. Literally, there's only 5 questions. It will take you no longer than a minute, 2 minutes. Just helps us improve on future summits and how well this session's gone for you. Let me know if there's any questions you've got. After that, you're free to go and carry on with your day. Thank you.
Thank you. And I've shared the link to the strategy as well in here as well. So if anybody just wants to click on the web page, just please do.
Yeah.
Thank you. Yeah. Thanks, Freya.
Thank you, Karen. I'll speak to you soon.
All right.
Bye.
Take care. Thank you. Nice to see you all. Take care. Bye-bye.
Bye.
Freya, it doesn't seem to let me answer those questions. Is it open?
Yes, it should be open.
So I've gone onto the link. And it says this question is not open for voting.
Oh, it was working fine this morning. What I'll do is I'll email it to you all. Do it in your own time. Save us all waiting around for technology to work.
Oh, thank you.
Thank you.
Thank you.
Bye.
Bye. Bye.